Declining Birth Rates White Paper, a white paper on how modern health, environmental, and medical risks are creating empty cradles. See the book link below for white paper figures or graphs. This white paper is written for public health, environmental, and policy decision makers who must understand the real drivers of declining birth rates in order to design effective long-term population and family policies. The purpose of this white paper is to reveal how modern health, environmental, and medical threats, often missing from official projections, are accelerating birth rate decline, and to outline practical actions that can slow or reverse this trend. In the pages that follow, the paper first explains the current birth rate tipping point and how quickly family structures are changing. It then examines a set of often ignored health, environmental, and medical risks that threaten future generations and presents concrete policy options that national and local leaders can begin implementing now. Executive Summary. Birth rates are falling faster than most officials realize, and the crash will not come gently or slowly. In one lifetime, the world has shifted from overflowing maternity wards and big families to empty cradles, shrinking classrooms, and entire neighborhoods quietly aging out of existence. Public debate usually blames culture, economics, or personal choice for this decline. But these explanations barely scratch the surface. Beneath the headlines, a web of modern threats is quietly cutting entire generations out of the future. Chronic disease, powerful pharmaceuticals, medical errors, environmental toxins, degraded indoor air and water, radiation sources, collapsing mental health, and policies that systematically reduce the number of people who ever reach healthy parenthood. These forces rarely appear in official population forecasts, yet they directly affect fertility, pregnancy outcomes, and life expectancy in ways that standard models do not account for. This white paper brings those missing factors into the center of the conversation. Drawing on engineering investigation, thousands of home and building inspections, and a wide body of medical and environmental research, it shows how today's homes, workplaces, and healthcare systems can be hostile to future children, even when families deeply want them. It argues that if governments and institutions continue planning on the basis of optimistic, undercounted projections, they risk walking blindly into rapid population loss, economic instability, and the quiet erasure of entire family lines. Yet the future is not fixed. By recognizing these hidden drivers of declining birth rates, decision makers can act now to change the trajectory. This paper outlines practical steps that public health, environmental, and policy leaders can take. Tightening controls on known fertility-damaging chemicals and pollutants. Improving indoor environment standards in housing and public buildings. Strengthening chronic disease prevention and oversight of high-risk drugs and procedures. Improving the accuracy and transparency of fertility, mortality, and abortion data. And supporting family formation and mental health initiatives that protect the next generation instead of eroding it. Taken together, these actions can slow or even reverse the slide toward empty cradles and replace it with a deliberate, informed, and humane approach to the future of human populations. Introduction. Why empty cradles matter now. In one generation, crowded delivery rooms and bustling schoolyards have given way to empty cradles, half-full classrooms, and graying neighborhoods where playgrounds go quiet years too soon. Across much of the developed world, fertility has fallen well below the 2.1 children per woman needed to keep populations stable, and more than 2/3 of the world now lives in countries below replacement-level fertility. Official projections often treat this as a slow, manageable drift, but the reality on the ground looks more like a cliff edge than a gentle slope. Public health and policy debates usually point to culture, economics, or personal choice to explain the decline in birth rates. Those factors matter, but they ignore a growing list of modern threats that quietly erase future children before they are ever conceived, born, or able to start families of their own. Chronic diseases, powerful medications, medical errors, environmental toxins, degraded indoor air and water, radiation sources, mental health crises, and high-risk social environments are reshaping who can have healthy children and how long potential parents live. This white paper places those hidden forces at the center of the population discussion. It explains the current birth rate tipping point, shows how family structures and expectations have changed, and then maps the health, medical, and environmental threats that standard fertility forecasts largely overlook. Finally, it presents concrete steps that public health, environmental, and policy leaders can take now to protect today's children, support tomorrow's parents, and avoid a future in which empty cradles become the norm rather than the warning. Rather than presenting complex mathematical derivations, this analysis uses simple scenarios to show how adding these hidden risks can accelerate population decline compared with official forecasts that exclude them. All sources used to support key claims are listed in the references section at the end of this paper. The birth rate tipping point. Within just a few generations, many societies have moved from large families and crowded maternity wards to fertility levels at or below 2 children per woman. Demographers call about 2.1 children per woman the replacement level, the point at which each generation roughly replaces itself. Today, most high-income countries and a growing number of middle-income countries are below this level, meaning their populations will shrink over time unless something changes dramatically. Figure 1 highlights how quickly fertility has shifted from large families to around or below replacement level in both the world as a whole and several major countries. See the book for the figure. Figure 1. Total fertility rates for the world and selected countries have fallen from large families to, within a few generations, at or below the replacement level of about 2.1 children per woman. Figure 1 shows how both the world and key countries such as the United States, Italy, and Japan have crossed below the replacement level of about 2.1 children per woman, turning slow change into a structural tipping point. See book link below for figures and graphs. This is not just a slow, gentle drift. Once fertility remains low for several decades, the number of women in their childbearing years shrinks, making it much harder to reverse course even if governments later introduce generous incentives or family-friendly policies. At the same time, aging populations create more dependents, fewer workers, and rising pressure on pension, healthcare, and social support systems, increasing the risk of economic and political strain. Most official population projections treat these patterns as relatively smooth and predictable, assuming that fertility will stabilize or gently recover. However, as argued in Empty Cradles, many modern health, environmental, and medical threats that harm fertility, pregnancy outcomes, and life expectancy remain absent from standard models. If these uncounted risks continue or intensify, population decline could be faster and more uneven than planners expect, turning what looks like a manageable trend on paper into a true tipping point in the real world. Shifting families, culture, and economics. In a few decades, the path into adulthood has shifted from early marriage and large families to later partnerships, smaller households, and more people who never have children. Younger adults now spend more years in education, carry higher debts, and often enter unstable housing and job markets before they even consider starting a family. For many, the idea of having several children feels unrealistic, not because they do not value family, but because the basic conditions that once supported it have eroded. Cultural expectations have shifted alongside these economic realities. Marriage happens later. Cohabitation and non-traditional family structures are more common, and there is greater social acceptance of remaining single or child-free. At the same time, social messages often emphasize individual achievement, mobility, and consumption over long-term commitments like raising children, especially in dense urban environments where space, time, and community support are limited. Public policy has not fully kept up with these new realities. In many places, the cost of housing, childcare, and education has risen faster than incomes, while support systems that once made family life more manageable have weakened or disappeared. As a result, even couples who would like to have more children often postpone or reduce their family size, turning what used to be a common life pattern into a difficult, high-risk choice. This visible social and economic shift is only part of the story. The next sections examine how hidden health, environmental, and medical factors further reduce the number of children who are ever born. Hidden health and environmental threats. Behind the visible social and economic changes, a quieter set of forces is reshaping who can have healthy children and how long potential parents live. Modern life exposes families to a mix of chemicals, pollutants, radiation sources, and biological hazards that previous generations never faced at the same scale or intensity. Many of these agents interfere with hormones, damage reproductive organs, increase miscarriage and birth defect risks, or contribute to chronic illnesses that shorten or complicate the years when people might otherwise be starting or raising families. Everyday environments now contain substances that scientists link to reduced fertility and poorer pregnancy outcomes, including certain pesticides, industrial chemicals, heavy metals, endocrine-disrupting compounds, microplastics, and air and water contaminants. Indoor spaces, where people spend most of their time, can concentrate mold, volatile organic compounds, fine particles, and other pollutants that affect respiratory health, immune systems, and fetal development, especially when combined with poor ventilation and building defects. In many communities, low-income households bear the highest exposure, further widening health and fertility gaps over time. Radiation and technology-driven exposures add another layer of risk. Certain medical imaging procedures, industrial sources, and poorly controlled environmental radiation can increase cancer and mutation risks, especially with repeated or poorly monitored exposure. At the same time, complex mixtures of pharmaceuticals and chemical residues in water and food chains create long-term, low-level exposures that are difficult to measure but may cumulatively erode reproductive health. These threats rarely appear in standard fertility or population models, yet they quietly remove future children from the population long before social planners ever count them. Microplastics and so-called forever chemicals now show up in human blood, organs, and even placentas, meaning exposure starts before birth and continues across a lifetime. Prior work on indoor toxicity and food contamination shows that people ingest microplastics and persistent chemicals through water, air, dust, and a grocery cart full of boxed, canned, and processed foods, which often contain additives, residues, and packaging byproducts that can interfere with hormones, fertility, and fetal development. The modern shift toward more indoor pets per household, often outnumbering children, adds another layer of quiet risk inside homes. Prior investigations have documented rising pet-related injuries, traffic accidents, and household contamination with parasites and bacteria, showing how well-meaning companionship can still raise background health and safety risks for families. Toxoplasma parasites carried by tens of millions of indoor and outdoor cats can alter brain function, slow reaction times, and increase the risk of car crashes and other accidents, especially in people who never realize they have been infected. Evidence from earlier work suggests these subtle changes in judgment, mood, and risk-taking can erode family stability and reduce the chances that some adults ever reach or remain in healthy parenting years, even though the underlying infections are rarely counted in fertility or mortality statistics. Electronic pollution joins these threats by surrounding families with electromagnetic fields from cell phones, routers, high-voltage lines, radio frequency and microwave sources, and bright screens that disrupt natural light cycles. Prior work on electrosmog and toxic homes shows that chronic nighttime exposure to these signals and light can worsen sleep, stress, and hormonal balance, which in turn aggravates chronic disease, mental health problems, and reproductive risks that quietly reduce the number of people who ever become healthy parents. Taken together, the places people live concentrate three kinds of hazards. Structural factors such as proximity to Superfund sites, nuclear facilities, and garbage dumps. Chemical factors such as asbestos, lead, formaldehyde, and fine dust particles indoors. And biological factors such as mold, bacteria, pests, and chronic humidity problems. Prior home inspections and health investigations show that these overlapping exposures quietly lower fertility, increase chronic disease, and early mortality, and matter especially because people now spend well over 70% of their lives inside homes, workplaces, and public buildings. Medical systems, chronic disease, and lost parents' data and communication pose further challenges. Many of the key drivers discussed here, from subclinical fertility damage to indoor environmental hazards and medical errors, are undermeasured and unevenly reported. Without better information systems, it is difficult for decision makers to see the full picture or to evaluate which interventions have the greatest impact on protecting future parents and children. Public communication is also sensitive. Messages must convey the seriousness of the risks without fueling panic, stigma, or policies that undermine personal rights and dignity. Given these obstacles, the most promising path is to start with targeted, feasible steps that build momentum and evidence over time. Governments and health systems can begin by creating cross-sector task forces that bring together public health, environment, housing, and family policy teams to map local risks and opportunities. Pilot programs can focus on high-impact areas such as improving indoor air and water quality in schools and maternity wards, strengthening chronic disease management for people of reproductive age, and expanding community-based mental health and addiction services. At the same time, investments in better data collection on fertility, pregnancy outcomes, environmental exposure, and preventable deaths will provide a stronger foundation for future decisions, ensuring that today's first steps lead to more informed, effective action tomorrow. Conclusion: from warning to action. Declining birth rates are no longer a distant, abstract trend. They are already reshaping schools, workplaces, and communities, and they will define the choices available to the next generation. The evidence reviewed in this paper shows that visible social and economic changes are only part of the story. Hidden health, environmental, and medical threats are quietly shrinking the pool of healthy potential parents and increasing the number of children who are never conceived, never born, or never reach adulthood. Treating this as a slow, manageable shift risks locking societies into a path of accelerating population decline and mounting economic and social strain. Standard projections, which often leave out key risks such as chronic disease, drug crises, medical errors, and environmental exposures, can give planners a false sense of security at precisely the moment when the most effective interventions are still possible. The choice is not between alarmism and complacency, but between acting on a full picture of the risks or continuing to plan around an incomplete one. Moving from warning to action means deliberately protecting the health and stability of current and future parents, improving the environments where children are conceived and raised, and aligning policy with the realities young families face. The specific steps outlined in this paper, reducing harmful exposures, strengthening reproductive and maternal health, cutting preventable early deaths, improving data, and supporting family formation, are all achievable with today's tools and institutions. What has been missing is not the capacity to act, but the recognition that empty cradles are a system-wide signal that demands coordinated, sustained attention. For white paper book or the longer version, Empty Cradles by Marko Vavic, see the links below. Please like, share, and subscribe. Settings: use only generated clips. Add any subtitle.